Hello and welcome to Tête à Tête, France 24's flagship interview show. Our guest today is Vanessa Kerry. In June, she became the first ever climate change and health Special Envoy for the World Health Organization. As such, she will be front and center at the upcoming COP28 in Dubai. So will be her father, John Kerry, who is the Special Climate Envoy of the Biden administration. Dr. Vanessa Kerry joins us from Boston. Thank you very much.
Thank you very much for having me today.
So obviously, when people think about climate change, they don't necessarily think about health. You were appointed, the first to be appointed in that position. What does it tell us about the importance of health in the climate change issue?
Well, I think we have learned with great understanding in the most recent years that the climate crisis is a health crisis. And already we see 7 million people a year dying from air pollution, for example. That's more than we saw in the entire COVID pandemic over 3 years. And that's one person every 5 seconds, so that by the time I complete my next sentence, someone else will have died. And we see this in every aspect of health, the way climate change is impacting our lived experience. And so there's a very real opportunity for us to have a health-centered approach to climate change and to be able to ensure that we're protecting how we live, how we breathe, how we walk, and what we can do in our lives. And so the appointment, I think, is truly just an opportunity to continue to really flag the urgency of what we face.
Right, because obviously we're already hearing the UN Secretary General ringing the alarm bell, saying we need to do more in terms of fossil fuels, we need more money and so on. Do you think that there's room enough and that there's money enough to address the issue that you're hoping will be addressed at COP and even down the road?
Well, I think the mistake, thank you. I mean, it's a terrific question. The truth is, this is not a mutually exclusive situation, and it's not a zero-sum game. So our ability to invest in our health and our well-being does not need to be competitive for where other dollars are needed in climate change. The reality is that investments in health are actually savings. For every dollar that we invest in health and strengthening health systems or in training a health workforce, which is what we do at Seed Global Health, the nonprofit that I run, if we do that, you actually see $2 to $4 of return on investment and benefits that can happen. We also know, for example, that we've spent close to $50 trillion mitigating the cost of air pollution, something that's been killing us every day. If we invested in the prevention side of things, we will save money rather than reacting. I think people don't realize also extreme heat, something that, for example, that Europe has been suffering from massively in recent years, costs us billions of dollars in lost productivity. So we have the opportunity to really change the direction we're going in by reducing our fossil fuel use, reducing our harm, improving people's health, and seeing the savings of that. But we have to choose to make those decisions and to follow the data and science that tells us that this actually is going to be an economic win if we make those investments.
Right. Do you have a figure, I'm sorry to be so blunt, in terms of what is needed from a global health perspective?
I think the figure is incredibly difficult to put out there because we have not taken, I think that we know that there is the opportunity to put easily, hundreds of millions and the billions of dollars to invest in strong health systems. We have to realize that many countries around the world have been suffering for years with poor health systems. We saw this in COVID, correct? I mean, we saw disruption of services in 90% of countries because we had failed to invest in strengthening health systems in the right way. So I don't want to put a figure to it because you're going to get into the semantics of parsing what is for health versus what is for clean energy. But if you invested $5 billion into the clean energy that we need in countries anyway to reduce fossil fuel use, but could create a stable component of energy and health for health systems such that you can deliver services and save lives, that's a win across multiple sectors. So we have to stop parsing this out about what is needed for global health rather than what is needed for us to start to do the right thing to invest in stronger countries, stronger development, stronger health systems, and a stronger response to climate change than we've been seeing today. All of these are sort of a unified investment that becomes a win-win across sectors.
Is this getting through governments in rich countries or even international institutions?
I think it's beginning to, and part of my job as a special envoy for climate change and health for the World Health Organization, as the CEO of Seed Global Health, as a physician, a mother, and being part of a community in global health is about building that awareness. But there's a lot of folks out there that are fighting very hard to make sure that world leaders understand that the climate crisis as a health crisis can actually be an important way to respond to this moment with a different kind of courageous decisions that are needed. Because it turns out that health actually costs us economically. It's the difference between whether a house sits above or below the poverty line. It's the difference between GDP growth for a country or expenditure and losses when we're dealing with, massive events from extreme weather. It is the difference between migration. There's going to be 1.2, climate migrants in the next 10 years at the rate we're going. And so that's going to be very real pressure for borders and for countries. So if people understand, and we're trying very hard to have leaders understand the profound impact that health has across multiple sectors, because if we take a health-centered approach to climate change, we have an opportunity to actually have a profound positive impact across a lot of these sectors. And so my hope is, with the first ever Day of Health at COP28 this year with the UAE, it's an opportunity for us to bring that education, bring that opportunity, and to really help folks understand that there is a different set of decisions we can make that can benefit their populations and benefit this world in a really different way.
Right. I mean, before you were appointed, obviously you've been a physician, but also on the ground in many countries through your NGO, Seed Global Health. Can you give us a very concrete example of how climate change hurts a country?
Very concretely. Seed Global Health has worked in Malawi for about 12 years now, and we have been partnering with the country to be able to build out nursing, family medicine, mental health. But they've suffered from a series of very severe storms that have been driven by climate change in recent years, which actually then has led to the largest and longest cholera outbreak the country's ever seen. Tens of thousands got sick, thousands died. And we found ourselves pivoting to be able to help support the Ministry of Health and the government to manage that cholera outbreak and to think about what education and training and to support the health workers in that setting. And then when Cyclone Freddy came through in the last year, and it was the longest and largest storm that Southern Africa has ever seen, it washed out bridges to some of the birthing centers that are so importantly needed for women to deliver safely. And so we were, a nurse midwife named Chansey Banda really realized that she had to advocate for these health centers. And so she started to press for new health centers to be open in places where the bridges weren't washed out to ensure that women had the ability to deliver safely, even in the setting of a storm. Because it turns out when we have these extreme weather events, women, it's not as though women stop delivering or stop having high-risk pregnancies. If anything, the high-risk pregnancy rates go up because of the stress of what's happening. So with Chansey's incredible advocacy, the government rallied, they asked Seed to support, and we ended up helping to support standing up new birthing centers rather urgently to be able to ensure that women could deliver and not one child or mother's life was lost in the centers where we were delivering. That's a very real and tangible impact, but we're seeing that in multiple countries around the globe, including in France, including in the United States. There is not a country in this world that is immune from the accelerating impact of climate change right now. And we have to be accountable to that.
Right. So you're going to be in Dubai. So will your father. He was here in Paris for the signing of the COP back in 2015 as Secretary of State. Obviously, the U.S., other rich Western countries are not exactly the best students in the class when it comes to fighting climate change. Are you hoping to encourage your father and what he represents to be more proactive and more generous, maybe?
So I think a couple of thoughts to this question. I think, first of all, I'm incredibly proud of my father, and I am deeply privileged to have learned from both of my parents what it means to be an engaged global citizen in this world and to fight for what is fundamentally needed to, to close inequity gaps and to make the world a better and more whole and just place. And that has been an incredible privilege. And but I'm also privileged by having a 20-year career in global health, working in resource limited health settings and on the front lines of very real patient-doctor interactions and vulnerable care to know what that complexity looks like, which informs very much my experience as well. And frankly, has been allowed me to also support my father in thinking through some of these things. And I think that what matters to me most in this moment, and that I think that has really been critical as we advocate in this and to look to what needs to happen as we emerge out of COP28, is that we have to stop suffering from what I keep saying is a pandemic of poor and expedient choices. Leadership around this entire globe, around all westernized nations, around every nation, has got to step up to this moment. We have got to have an immediate and just transition from fossil fuels, where every decision we make is no longer increasing the greenhouse gas emissions, but every decision we make from this point on is going to start to reverse that decision. We all have a responsibility, whether we are a political leader, whether we are a private sector leader, whether we are an individual. This is literally not just my children's future or your children's future. This is the reality we're living every day as we confront these moments. So we're going to need a different kind of bold, courageous leadership, and we're going to need leaders to realize that their population's well-being, their population's health that they're, respecting, is actually going to be deeply interconnected to everybody stepping up to this moment. So I'm very hopeful that at COP28, we get to see a different kind of leadership and a different set of decisions and an acceleration of the progress that we need to make. And I think that is what my job is in this moment, is what a lot of my colleagues feel very seriously. And I think that is the opportunity that can come from COP. But it's not just about what we do in these 2 weeks. It's about them every single moment thereafter, and the accountability we create, the decisions we make, and the kind of progress we do to ensure our planet's health, its population's health, and frankly, our survival.
Vanessa Kerry, I want to thank you very much for appearing here on France 24 from Boston. And thank you all for watching this show. Stay tuned for more news.